around himself. That's just the picture we focus on. But I must say that mental health issues go beyond this. And I know that at the end of our presentation, we will actually know where we even come in, where we fall short, and where we fall short, not just because of a character flaw or a weakness, but just because we are human beings, just because situations happen, just because we are in this life full of ups and downs. So again, WHO has a definition. When do we say you are mentally healthy, you have good mind health? WHO looks at 4 components. You should be able to realize your ability or capabilities. You should be coping with normal stresses of life, regardless of the stress. It could be a loss, relationship loss, money loss, whatever kind of loss. It could be a difficult situation you are going through, financial situation. All these are stresses of life. Are you able to cope with these stresses? WHO also says that you should be productive and fruitful. Productivity is in several domains. What it means is that, are you able to play the role that you find yourself in? So if you are a mother, are you playing your role as a mother? If you are a worker, are you playing your role as a worker? If you go to school, are you performing well? Even in the wider social context. So whatever role you find yourself, and oftentimes it's easy when we are not functioning well. So, for example, we are not able to show up at work. But then there's also what we call the presenteeism, where people show up, but they are not able to even maximize their potential, work to their full abilities. And that is still having an impairment in your productivity or your functioning. And then lastly, the last component that you need to meet for us to say you are mentally healthy is when you are making a contribution to society. So oftentimes, like I used in the initial example, just thinking about the extreme when someone has mental illness. But I must say that this is just a very small proportion of the population. A majority, an overwhelming majority of us are in the middle. We are not mentally healthy. We are not meeting this full potential. But maybe we haven't yet been diagnosed with mental illness as well. And this is where WHO calls mental ill health. So you may not have mental illness, but you may be having mental illness just because of one situation you find yourself or another. And so it brings me to this spectrum, which you need to understand as I go through my presentation on the maternal mental health. You can see that it's an arrow going in 2 directions, and it starts from a, a place which is colored green when we say you are mentally healthy, which I just described, when you meet all the 4 components, to when we say you actually have mental illness, that is the red. So what I was also talking about was the part in the middle, colored amber or orange. This is where a majority of us find ourselves, depending on the situation. So for the yellow, when you are facing a stressful situation and you are reacting to it, we say that you are having mental. How we felt when we reported the first COVID-19 case. We were all anxious, we were not sleeping well, people were agitated. Checking the numbers, we were having some form of mental distress. Now, when you are showing symptoms, any kind of symptoms, and that is the orange. Now, for us to be able to say you have mental illness, usually you meet clear diagnosis. Your symptoms, you significantly impacting on your functioning. Oftentimes, at this stage, you meet diagnosis and maybe your doctor tells you with